Now, in this lecture, I will talk about complete hydatidiform mole. A complete hydatidiform mole occurs when an empty ovum is fertilized by a sperm. About 80% of complete hydatidiform moles are 46XX, which originate from duplication of chromosomes of a haploid sperm, and other 20% are 46XY, where all the chromosomes are paternally derived. Although all chromosomes are paternally derived, mitochondrial DNA remains maternal in origin. The etiology is abnormal gametogenesis and fertilization, and the site is placenta. As you can see here in this image, a haploid sperm when fertilizes an empty egg, and there is duplication of haploid sperm's chromosome after meiosis, there is formation of 46XX complete hydatidiform mole. In another scenario, when two haploid sperms, 23X and 23Y, are fertilizing a empty ovum, then there is formation of 46XY hydatidiform mole, which is complete, and this is called dispermic fertilization or diaspermy. And in another scenario, a 46XY sperm, when fertilizes an empty ovum, then there is formation of 46XY complete hydatidiform mole. In this, all the chromosomes are paternally derived. J- You should always remember this, and that's why this process is also known as androgenetic. The risk factors are extremes of maternal age, like less than 20 years old and more than 35 years old, any previous molar pregnancy, previous spontaneous abortion or history of infertility, diet deficient in carotene, which is a vitamin A precursor, smoking, and genetic predisposition. The patient will complain of abnormal vaginal bleeding during the first trimester, and the uterus is significantly enlarged for the gestational age. The human chorionic gonadotropin hormone is elevated for gestational age, and patient can also present with pregnancy-induced hypertension, hyperthyroidism, and hyperemesis gravidarum, the medical complications of pregnancy. As I have already mentioned that the HCG level is more than 100,000 international unit, and the pelvic ultrasound will show snowstorm appearance in the uterine cavity, an absence of amniotic fluid, absence of embryo and or fetus. You can see in this image cluster of grapes appearance on transvaginal ultrasound, and in this image snowstorm appearance of the complete hydatidiform mole. Grossly, they appear bulky with hydropic changes in all the villi and appear as semi-transparent vesicles of variable size as shown in the image. Classically, they are described as bunch of grapes, and the individual vesicle can measure anywhere from 1 to 30 millimeter, and total weight is usually more than 200 grams. No fetal parts or embryonal structure is observed. Microscopically diffuse villus enlargement with marked hydropic changes is noted. Cistern formation and marked trophoblastic hyperplasia, usually in a circumferential pattern, is noted. And remarkable cytological atypia is almost always present. The mitosis are common. As you can see in this image, there are enlarged and dilated edematous villi which are avascular. There is cavitation in the center, and which is also known as cistern, and there is increase in cyto and syncytial trophoblastic layers or trophoblastic hyperplasia, which is usually circumferential in complete hydatidiform mole. This is the H&E micrograph of complete hydatidiform mole, and you can appreciate here the villi, which are avascular, having hydropic changes in cistern, and circumferential hyperplasia of the trophoblastic cells, both cyto and syncytial trophoblasts. Immunostain P57 can be used to differentiate between complete and partial moles, as P57 is negative in complete hydatidiform mole, whereas it is positive in incomplete or partial mole. And cytogenetic study shows diploid nature of complete hydatidiform mole, whereas diploid nature of partial hydatidiform mole, which I will be talking about more in my next video. The management of molar pregnancy includes dilatation and curettage, and hysterectomy is a definitive treatment to prevent future risk of choriocarcinoma in patients with complete hydatidiform mole. It's generally done in females who have completed their family and are more than 35 years of age. My next video will be on partial hydatidiform mole and invasive mole. If you're liking my videos, do subscribe to my channel and share it with your friends and comment. Thank you and bye for now.